We can't even see everyone now.
Okay, we have 9:01. Good morning, everybody. I just want to ask if you would be kind enough to mute yourselves. Please, we're going to ask you to use the chat if you have questions, but the danger in muting everybody is trying to find our speakers and unmute them. So the mute button is at the bottom left-hand corner, and you'll hear yourself talk if you talk. So we just ask you to kind of keep quiet and mute yourself. At this time, I'm going to turn it over to Commissioner Kreiner to kick us off.
Well, good morning, everyone, and we're happy that you're joining us today, this new wave of communication. If at any time you have a question during this, if you can use the chat button that's located at the bottom of your screen, or if you're simply just calling in, if you have access to email your question to soschman@bradfordchamber.com, and we'll address your questions towards the end of today's presentation. We have and continue to experience challenging times brought upon us by the COVID-19 virus. Through all this, we realize and appreciate our businesses that are critical to the vitality of our community. Today's session provides us with timely, relevant, and useful information. During this session, we are going to get an update on the governor's plan, review the COVID-19 planning, and insights and tips from Zippo Manufacturing on information that may be helpful to you based on their experiences. This will be followed by a list of local funding that is readily available to help our businesses. Now I will turn it over to Bradford Chamber's new Director, Heidi Scrivo-Passmore.
Thanks, Tom. So just very excited to be in this new role at the Chamber. I am really looking forward to meeting our members and getting to know everyone and feedback on what you loved about the Chamber, what you would like to see at the Chamber. We are coming up with some great new ideas, but right now, obviously, all of our lives are focused on—
Hello. Hi, Dave.
Go ahead, just keep going.
Yep. So,
Good.
Please mute your phones.
So right now, we're just focused on getting through
I'm gonna take it, Lynn.
I'm going to turn it over to
I think maybe I should get a switch.
Shane, can you ask Sarah? She can mute everyone. With this many callers, if somebody puts us on hold, we'll never get it through.
We're working on it.
Okay.
There's another screen that can pop up if you go out of, like if you click on the people, if you click on the people at the bottom, manage participants, and then you can mute everybody.
Oh, mute. Oh, there it is.
Right. So even though he.
Okay, can you all hear me? Okay, what's going to happen, I ask you that if you're a participant, you'll have to unmute yourself to speak, and then please remute yourselves. We have already started the conference call. We thank everybody for being part of it. We're going to continue with our agenda. If you have questions, please use the chat box, and we'll address your questions at the end of the live meeting, or we will address them through email if there's too many questions. As you're all aware, the governor has put out a plan for reopening. If you want to put that up, Sarah, and you can just go right to the third slide, please. The governor has put up this plan. We had 15 attachments for you. I hope you weren't overwhelmed by that, but we wanted to give you all the valid information. This is the governor's plan. It's 7 pages long. But the thing is, we need to reopen, and we wanted to help you be able to do that and answer any questions you might have. So if we go to our next slide, the governor has basically put out these reopening phases. This is part of your packet. As you know, we're moving to the yellow phase as of Friday. I'm not going to, for the sake of time, I'm not going to read it all to you, but we know that schools will remain closed. We know that we can't have large gatherings still at this time, and things such as gyms and spas will have to remain closed at this time. Restaurants will be carry out and delivery only, but our retail stores will be able to reopen, which is pretty exciting. However, we have to have a plan in place. I will point out that there's a green phase, and if you read what happens in the green phase, we're still going to have guidelines from the CDC and the Department of Health. And I think it's going to be quite a while till we get to the green phase if you've been following the news. So we may be in the yellow phase for quite a while, and that was the purpose of today's call. This is a helpful link for you. The first is the back to work checklist. It's a little bit convoluted, it's a little bit hard to follow, and it's more driven from the governor and what needs to happen within the state than it is driven for just the workplace, but we thought you might find it helpful. So feel free to check out that link. And again, it's in your packet, so you can just click on the link. The other is from OSHA. It's a really nice guide. And the OSHA guide will talk about you reopening as a business owner. It will talk about what employers are expected to do, and it will talk about what employees are expected to do. And it will help give you guidance moving forward through these different levels that the governor is putting out there. And with that being said, we do have an expert on the phone that can talk to us in more detail, and that is Chief Eric Taylor from our fire department. And Eric, I turn it over to you.
Morning, everyone. For those who don't know me, I'm Eric Taylor, and I'm the fire chief for the city of Bradford. And I've been asked to talk about my role during the coronavirus and also to touch on the OSHA guide on preparing workplaces for COVID-19. So my role has been to maintain the health and safety of my employees while ensuring the needs of the community are met at the same time. Within my role, there has been some challenges, some like securing enough PPE for my staff and for patients who we may encounter that meet the COVID-19 criteria. Also, there's been a lot of different guidances out from the PA Department of Health and the CDC and other health-related agencies that we've been continuing to monitoring what they have. And with that, we've had to constantly review and change our policy and procedures on how we use our PPE and even how we proceed with patient care. And finally, I've had to prepare for the worst case scenario for my department. Where do we get additional paramedics and EMTs to backfill the station if the virus were to hit the fire department? We're expected to continue to provide fire and EMS services to the community, no matter what's going on. Next, I'm going to talk a little bit about the OSHA guide for preparing workplaces for COVID-19. Within that guide, there is an occupational risk hazard pyramid. Look and see where your business is going to fit in on that pyramid. And there's going to be an administrative and engineering controls that you should follow based on your category. Next, we're going to talk a little bit about PPE. PPE should be based on the potential hazard to your workers. And that, again, is going to be based on where you fall into this pyramid. Your PPE should fit and be worn properly and consistently. Your PPE should be properly maintained and replaced as necessary. You should clean regularly the PPE that can be reused, and that's going to be your cloth masks. And since I'm talking about masks, we're going to talk about what the state has provided for guidance. You should be able to provide masks for all your employees to wear during their times at work and make it mandatory for them to wear. Also require customers to wear masks when on your premises, but be aware there is a clause within the guidance from the Department of Health that says individuals who cannot wear masks for medical reasons may enter the premises and they do not have to provide any medical condition reasons for them not wearing a mask. But also I'm going to note this changed on Monday with the Department of Health talking about the relaxation of the guidelines. It is recommended for customers to wear masks, but not required starting Friday. But it is still required for your employees to wear the mask. You also should prepare your business to implement some sort of infection prevention guidelines, promote frequent hand washing, encourage workers not to report to work if they meet certain illness criteria. And up on the screen, you see the algorithm we use at the fire department. There's in box 1, there's the temperature of 100, body aches, shortness of breath. There's some different criteria. If your employees meet that criteria, they should not report to work. If they start to meet that criteria while at work, you should send them home. And also in box 2, you see cough, severe or sore throat, and runny nose. It's kind of scrambled here. It's hard for me to see. But be advised that there can be some chronic illnesses with your employees that could also have this. So it's not always going to be COVID related with BACC 2. Maintain routine cleaning and disinfecting of your surfaces. When disinfecting, make sure you take into account the manufacturer's recommendation for the product you are using. Many of them want the product to sit on the surface for a period of time before wiping it off for them to be effective. And finally, if employees use a shared space for the break room and lunchroom, be sure the proper social distancing measures can be followed. If they can't, consider staggering breaks and lunches. With that, I'm going to turn it over to Alicia Marshall of the Small Business Development Center.
Good morning. Hey Shane, are you going to be sharing the screen for my presentation?
Coming up right now.
Okay, great. All right, perfect. Good morning, all. My name is Alicia Marshall, and I am a business consultant at the Clarion University Small Business Development Center. Though your business may be closed, now is time to start preparing for your next chapter, and the SBDC is here to help you along the way. Here's a map of Pennsylvania and their respective SBDCs. If you are not in our 10-county region, they're in orange, you can still reach out to me and I can forward your information to the SBDC that can help you. Go ahead and go to the next slide. We provide entrepreneurs with education, information, and tools to start and grow your business. The consulting is one-on-one and at no charge. We are completely confidential, but do not have any money to lend. We are just here to help you seek it. Go ahead. If I had more time, I would review this in more detail, but I just want you to see that the SBDC can provide assistance throughout the life cycle of your business, from employee manuals to business plans to research and website reviews and financial analysis. Go ahead. So here's the meat and potatoes of the presentation. We would like to first start with plan. So use your time now to develop a plan for reopening the first 3 months. Consider what you have learned during this time that will benefit you and your business in the future. Define goals and create a to-do list of items with target deadlines. 2 is employees. A successful relaunch and recovery of your business will depend on the ability to retain talent. Make employee engagement a priority. Consider your reopening hours. Come up with a plan that is fluid for what schedules might look like under several different operating models. And continue to stay in close communication with your team and share your plan with them when ready. 3rd is vendors. So hopefully you've been communicating with your vendors throughout all of this. I'm sure you have been. But remember, your vendors are an important part of the team. Review your current inventory as compared to what you project your sales may be when you reopen. Initially, cash flow will definitely be tight, so talk with your vendors now about payment options. Many of your vendors may be willing to consider 30, 45, or even 60-day payment options on any new orders. 4th is customers. So customers may still be hesitant to be out in public. Start off with the basics, such as making sure your establishment is fresh, clean, and organized. Re-engineer the physical space for social distancing, and depending on your business, make sure, for example, the inventory is stocked, menus are updated, and you and your employees are ready to provide outstanding service. Show your appreciation to your customers through welcome back promotions, offering new services, and remembering to always thank them for their business. And lastly is cash flow. So prepare a projected income statement. Remember, this is a projection, but this exercise will help you be better, and we are here to assist you with it. Statements should be broken down by month, include projected sales and all expenses, and develop several scenarios that reflect what it may look like when you are back in business, prepared for fluctuations in cash flow. So there are options for you if you have used up all the SBA funds you were given or you could not apply. Although they're not as cheap as PPP or EIDL loans, first, it's important to note that you should not use line of credit for disaster relief. Lines of credit are to be used for temporary fluctuations in seasonal businesses and should not be used to recoup a loss from a shutdown because that is considered a permanent loss. So instead, a line of credit should be used to recoup from the profitability of the business. So I'm going to give you an example. So a farmer may use a line of credit to purchase seed in April, and it is paid off at the end of summer when the crop is harvested. So there are a couple options, and Shane's going to talk to you in the next section a little bit about what's available for Bradford. But an option would be to use the classic SBA 7A program. The SBA will need projections to determine that the loan can be paid back, and there's an option to be interest-free for the first 6 months. And it can be termed for up to 10 years. One other option would be to refinance a piece of equipment and stretch out the term. As long as the cash flow is at least 10% improvement, then it'll be eligible under SBA. Go ahead and go to the next slide.
I actually don't think I have a next slide for her.
Okay, so I'm going to actually pass the torch on to Ed and Jeff from Zippo.
Oh, let's see then.
Morning, everyone. Good morning, everyone. Go ahead, Ed. Well, I guess just to start off, we've been planning for this for some time. We've had a team in place, a pandemic response team, a pandemic response plan. But definitely our disclaimer here is that this is some of the things that has worked for us. It may not work for everyone. And this is based on our best interpretations with our legal team, our HR team, and some things that have worked for us. So we certainly are not experts, but we're happy to share what we've learned, what we've put together, and I believe you all have some of the documents that came from us as well. So we've been at this for a little while, as we mentioned, and some of the things that we're doing that I think are going to spill over to, let me jump back because we need to make sure that we segregate. We've focused mostly on the employee level, and I know a lot of folks on the call here are from the public, going to be reopening retail stores and things like that. So the regulations and the guidance we've been following might differ slightly from what you might be looking at. We are hopeful to reopen our museum here as well, which falls into the retail category. So we're putting some things together there, but by all means, we don't have all the answers. But as a good community neighbor, we're willing to share with what we have. So we'll start with our screening process, and I'm going to let Jeff talk a lot about what we've done from the sanitation, the cleaning, some of those requirements that we have. But for the most part, our top priority always has been the safety of our employees. So we have implemented the masks, we have implemented social distancing. Those are some things that we started early on. And certainly we've had our challenges as we have employees come back. I think one thing that most everybody might struggle with is the fact that people are not going to be comfortable wearing masks, especially if they haven't done so before. But there are lots of options from the surgical mask. The CDC and the Department of Health have some great guidance on and allow folks to make their own masks, which might help. I know it's helped a little bit of employee morale where you get them involved, they can make a mask. As long as they follow the guidelines, you're safe. And again, we still struggle with some folks that have some medical conditions. So those are things to be mindful of. We have opted to pre-screen all of our employees before they enter the building, which you'll find in some of the guidance there. It technically says before they come in. We've opted, which is probably not going to work for everybody, but we actually have set up a drive-through model where folks don't even have to get out of their car. We maintain our social distance at that point. We do ask them a series of questions every day based on the COVID guidelines from their personal health. We do take their temperature, note anything that's out of the ordinary. We give them a mask, and they're on their way. Once they walk in, we have obviously hand sanitizer, hand washing, and again, I'm not going to get into a lot of the things that Jeff and his group have put into play. But if there's anything specific, and Jeff kick in here, that we can help with or answer questions later on, again, we're always willing to help out.
Well, thank you, Ed. I think a good way to look at the approach for preparing to reopen is what we have done is we try to create layers of mitigation. to protect ourselves from the virus. So the layers obviously begin with employee screening at the gates of the facility. So before they even come on the facility, we have temperatures, we have a question and answer period. We get to lay eyes on folks to see their condition. As Ed stated, this probably isn't practical for the majority of the smaller businesses, but for us, we felt this was a real good tool. The next layer is, the masking. We decided to go masking across the board for our employees. Now, some of the masking restrictions are lighter for office people. They're in their workspace. There's nobody around. We can relax some of those, but for the rank and file, we have masking going on. So that's another layer. Another layer would be our cleaning. We have a very aggressive cleaning program per the guidelines. So we have folks dedicated to certain areas of the facility, and those folks go around and they basically constantly rotate through high touch areas. So they're cleaning doorknobs, door handles, restrooms, any areas where you're going to have multiple people going back and forth. You can make it simple. It's the high touch areas. People still need to touch things, but you can go back through and clean. So that's a layer. We've opened doors where we can do so safely, where we're not risking any fire code type of issue. So we have doors open so you don't have to touch doors. We also keep people in their certain areas. So if you work in one area, you really shouldn't be in any other area. That way, if we did have an incident where we had an infection, we can trace those folks back. We know where they've been. We limit our exposure, so to speak. So that's another layer. We also went to the extent of closing our break rooms. We're not using vending. We're really tried to eliminate as much of the potential exposure as we could. Now, again, these things won't work for all the businesses, but these are just some of the things we looked at. We tried to create layer. So you could have a failure in any of one of those, but you have enough layers that you're going to really mitigate the overall risk to your organization.
One of the things that we dealt with and anticipated early on was employees' concerns to come back to work. And with all these layers that we put in, if they may have been a little skeptical early on, once they came in and saw all the precautions that we have in place, as Jeff mentioned, for the most part, 99% of the folks feel more comfortable after day one. So that's something that, some may or may not struggle with, is employee hesitation on coming back. But as Jeff mentioned, we try to eliminate all the touch points. We try to do as much as we can for them at this point in time. So Shane, you'll have to let us know where we're at on time, so we can certainly turn it over anytime.
Time and questions.
Okay.
Yep.
Thank you, Ed, and thank you, Jeff. You both did a wonderful job. And I just want to let the entire group know that Zippo has been kind enough to share their best practices and very comprehensive plans that are part of your packet. It can be overwhelming, but it can be it's very, very thorough, and it can be very helpful to you and your organizations. So I just want to thank both you guys and Zippo as well for being willing to share that with our entire community. It's very much appreciated.
You're welcome.
Sure thing.
We're going to move into resources now, and our slideshow will come back up. So give me just 1 second. Okay, so here we are in our resources. As was mentioned earlier by our commissioner, there are some, and by Ashley as well, there are some, or Alicia, there are some good tools out there and some money available to you. I'm sure you all have struggled to get some funding, and I know it's just a tough time for everybody. But we want to talk about some things that are happening. And our friends at the Bradford Office of Economic and Community Development do have a loan program out. This is in your packet of information that we emailed to you. So I only have this one page up as a guide. But they are doing small business emergency loans right now. They have loans available for up to $10,000. The interest rate is only 1%. the first 90 days, the program is deferred. So you would not have payments in the first 90 days. The maximum loan amount is $10,000, and it is then a 3-year term in repaying on that loan. Also in your packet is the application. So Anita Dolan is the contact for this, and at the end we do have a contact page, and we will be emailing that to you as well. But Anita Dolan is the contact. The OECD was fortunate that they had roughly $250,000 they could put back into our community. I do know that the program is already active, and they already have a bunch of applications and closings that are about to happen. So if you are interested, you may want to act on that sooner than later. This loan is available to any business in the city of Bradford, Bradford Township, Foster Township, or the borough of Lewis Run. If you are outside of that area, we then partnered with our friend Sherry Geary at the county and in her DCED department. And she is partnering with North Central. So this again is in your packet. North Central does have loan programs, and as you are looking to grow or expand, because we got to think positive here, we will get through this part, and then we're going to have a sturdy economy, we're hoping. And as you want to do that, North Central very much is willing to partner with you, and the DECD will potentially provide matching funds as well. So Sherry wanted me to be sure to mention that program, and again, it's in your packet. If we go to the next slide, oh, we didn't have the second page in there. And then DECD also has a program that's in your packet, it's just not in our PowerPoint, that is specific funding right now that may help your capital situation. Again, the contact will be Sherry Geary, and we do have her on our final slide that will be emailed to all of you. And if we go to the next screen, we just want to take a moment to mention another program. You may be concerned about people coming into your business without face masks, and it may be a challenge to find face masks. I just want to mention that there is a resource for that. So we have very wonderful people in this Bradford community who have stepped up and have made face masks. They are washable, they are made from cloth, and this was completely driven from a grassroots effort. If you need some masks for your business, you can call the number that's provided here, and this is also in your packet of information, and they will deliver some masks to your business in case somebody was to come in without a mask to help you there. So a big thanks. This community never ceases to amaze me, the people that step up to help out. And this was a grassroots effort of folks that put this together. So please, by all means, take advantage of it if you need masks for your business. Now, we do have a couple of other exciting programs that have just been added to our seminar this morning. So I'm going to turn it over to Tom Weibel and Deb Lutz to talk about the COVID recovery program. So Tom and Deb, if you'd be kind enough to unmute yourself, and we'll turn it over to you.
Good morning, and thank you for adding us last minute to your meeting agenda today. I'm Deb Lutz. I'm the Erie Regional Director for the Steel Valley Authority's Strategic Early Warning Network program. And Tom, if you want to introduce yourself.
Yeah, I'm Tom Weibel with the Northwest Industrial Resource Center, and I cover the 6 counties in North Central. I also have a counterpart, Andy Idzik, who covers the Bradford area, and we're teaming up with a few resources to try to help manufacturers and retail businesses and service industries get back on their feet.
Mm-hmm. So in your documents that were included with your meeting agenda and attachments, there are 3 documents that I wanted to reference today. The first is a program outline and contacts document for a program that we are calling the COVID recovery program. There's a triage process document and an assessment form. And I will follow up after this meeting with a training manual to Carolyn to distribute to all participants. So basically, the COVID recovery program is a program that has been developed by the Northwest IRC, Tom's agency, in response to the current COVID pandemic. The Northwest IRC has received some funding to help businesses throughout this process. We have engaged partners, my agency, the SOAN program, as well as the SBDCs and rapid response are participating as well. Basically, what the COVID recovery program is just to provide timely assistance to companies once you are able to reopen. We have developed, as I said, the program outline and contacts for the program that basically provides anybody with a guide for whatever status the business is in currently, whom to be able to refer that business to for assistance. And I should mention that with the grant funding that the NWIRC has received, as well as my program, which has always provided free consulting services to manufacturers, there should be little to no cost to any business that wants to get assistance through this program. So the program outline and contacts is a pretty easy to follow document that just gives you whom to contact in what situation. There's also a triage process that we are developing that also will help gauge where the business is currently. That follows with a tactical action plan that will be developed. And then finally, the assessment form that we are asking all business outreach partners that are out there meeting or talking to businesses to use. It's not required, but we're asking that you go down through a list of questions that have been developed on the assessment form, and then get that back to Susan Howman at the Northwest IRC, who's the project manager for the COVID recovery program. And she will then assign a project number and then turn it over to another partner, or the NWIRC take on that assessment form. I should mention that we are working in conjunction with Brad Lashinsky and the Launchbox. They recently did a survey, as you all may know. They had 287 responses to that survey. We had a nice discussion with Brad yesterday, and he's going to be turning over those survey responses to us by the end of this week, so that we can immediately contact those businesses that indicated on that survey they need some help. So that's what this program is all about, getting the help to the businesses that need it immediately. NWIRC and SOAN will be working with all manufacturers, and the SBDCs will be working with all non-manufacturers. So again, we're looking to roll this program out early next week. We will get the final assessment forms that are fillable PDFs to Carolyn to distribute to all partners when they are finished, hopefully later today. For those folks that do the Engage business survey through the state, these PDF documents should be able to be uploaded into Executive Pulse. So you should be able to get, your credit for doing any kind of business outreach through this program as well. Tom, is there anything that you want to add?
No, you covered it pretty well. All we're trying to do is to gauge where a company or a manufacturer or a service or a industry is at, whether, sadly, if they're in danger of closing, if they're in danger of layoffs, if it's cash flow or marketing. We're going to try to cover in these tactical action plans the gamut. And one of the main goals is to make sure we have the right agency working with that company, so they don't have to wonder where to go or wonder where to get the answer.
Right. There's no wrong door. I'm sorry, Tom. There's no wrong door. If you were to do an assessment and to turn it over to my agency, and I'm not able to assist those businesses, because typically the SOAN program works with small to medium-sized manufacturers that are experiencing some kind of distress that may cause them to look to lay off employees. We're a layoff prevention program. That's where we specialize, and we specialize in doing in-depth financial analyses. If it's not a fit for my program, I certainly can and will turn it over to the NWIRC in the case of manufacturers, and in the case of non-manufacturers, it goes automatically to the SBDCs for their assistance. So I know there probably will be questions. We'll remain on the line here. Feel free to to ask questions, or Tom or I will be available via email after, that we can send out, additional documents, as I said, when they're available. Thank you.
Thank you, Deb, and thank you, Tom. Appreciate you both being on the call such last moment. Before we move into the question portion of our meeting, from a resource standpoint, there's one more person. The first vice president of our chamber just texted me. That is Kevin Teaberry, and he is the owner of B&T Contractors, and just wanted to chime in for just a minute or two to talk about the cleaning they've been doing through this COVID-19 and to help all of you with cleaning as well. So Kevin, if you want to take just one moment, that would be fine. Kevin, you have to unmute yourself. Okay, maybe Kevin had to step away. We'll move into any questions. We're pulling up the chat now to see what questions we may have, and we'll be happy to pose those questions. So it doesn't look, this is a lot of information to process, we understand. It doesn't look like anybody has written us any questions yet, but that's okay. I'm not surprised by that, because there is just so much information that we've gone over that you would really have to process the information. All questions can be sent to me. My email is soschman, SOSCHMAN, @bradfordchamber.com, and I am on this contact information sheet that we brought up. I'll be happy to get the questions to the proper people and get you answers to any questions that you have. I want to thank all of the people that participated today. You'll see Tom and Deb are not on this PowerPoint slide, and it's because we had already sent this information on to our technician for the day, so we couldn't add them in the late hour yesterday afternoon. But when we send this out to you via email later today, we will have their information on there as well. I will also just want to take a moment to thank Sarah Larson here at Journey Health Systems for helping us out. And we do have a question coming in, so we have time and we'll move on to the questions. Heidi, can you just read it?
Yep. There's a lot of okay. First one is, what is the recommendation to a business for someone who comes in not wearing a mask?
So Chief Taylor, would you take that one? What is the recommendation if somebody comes in without a mask?
So right now, people who have health issues are not required to wear a mask, and they don't have to prove their medical condition. Friday, it's changing to a mask for customers is going to be recommended, but not required. So there's really nothing you can do about it, especially starting Friday.
The next question is, there is a lot of conflicting information between Pennsylvania and what the CDC recommends. So this is for Ed or Jeff of how you handled this at Zippo.
Well, is there any specific scenario? We've followed both guidelines, and for the most part, they've somewhat lined up. PA may be a little bit more specific. I guess maybe we could ask for a follow-up specific question, and we can answer via email.
Okay.
Well, I also think that if you're faced with conflicting information, then you'd err on the side of caution. So you'd perhaps go with the most stringent, and then walk it back from there.
Yes, I think that's great. Yeah. We do have a comment from Linda Devlin at the A&F Visitors Bureau that they're happy to promote all McKean County businesses when you are reopening your shops. We'll send the email when we send out the PowerPoint presentation of how to reach Linda. So,
Is that all questions?
yeah, that's all the questions.
Okay, can we go back to the contact slide? So we're just pulling up that contact slide again for you. Again, you'll get this. Everybody who was on the call will get a follow-up with this. We are totally open to any feedback too. So if you have questions, send them to me. If you have feedback of whether this was helpful or not, what you wish we may or may not have covered, we can try to do that through our other means, which is our newsletter, our e-blasts, Facebook, and our website. This seminar, we hope, will be available. It's been recorded. Sarah helped us with that. And we hope it'll be available through a link. It's too big to send via email. So we're going to try to attach that to our website today. When it is available, we'll be able to, we'll advertise that it's available also. Again, on the contact sheet, we'll be adding Deb and Tom's information, and you can send questions directly through me, and I'll be happy to pass them out to the correct person. So with that being said, I will turn this over to Carolyn Newhouse. And Carolyn, you can wrap things up for us.
Great. Can you hear me?
Yes.
Okay. So just a follow up. I received notification regarding WEDNet. So this just is additional information under your resources section that came out late yesterday. The WEDNet program has changed some of their guidelines. So for any business that participates in WEDNet, you should know that if you're a buyer this year, they've waived the buy year, increased funding, and they've consolidated all of the funding, so it's no longer divided between professional development and technical. So you could apply all funds to one training. So I'd recommend any businesses who participate in WEDNet to go ahead and reach out to our contact for WEDNet. And then closing, you know, I was thinking about, I'm looking out the window and it is snowing and it's May 6th, right? And that just reminds us that our town motto of cool temperatures, warm hearts really applies here, because I think the fact that we have nearly 50 participants on the call really shows how much we all care about our businesses and each other, and that we're all in this together. So with that, I'd also like to take a moment in closing just to thank everyone who's participated. So one, the participants and the businesses, you have a lot going on right now, so we appreciate your time. I appreciate the leadership position that the chamber took. So Shane and Heidi, thank you so much for all of your work in making this call happen. All the speakers and their organizations who participated today, and as well as our providers who may not have been on the call but provided useful information. And then finally, Sarah Larson and Beacon Light in particular. So they provided resources, expertise, and time in helping facilitate a successful Zoom call. So thank you. So to everyone on the call, just know that there's a lot of people here who are, you know, excited that you're opening up. We're ready to support you, and we wish you the best of luck.
Thank you, Carolyn. And again, thank you to everybody and to Carolyn for helping out with this. All of our partners that helped put together this presentation, as well as our panel of speakers today. The chamber office, I'm happy to say, does intend to open on Friday with you. So if you need something, we've been in the office anyway. We've been responsive to phone calls and emails, but as of Friday, we'll be there. So call us, stop in if you need to, and we're here to support you. We've been saying our doors are locked, but our arms are wide open. So reach out to us, and we'll do anything we can to help in this reopening. Best of luck to all of you as you reopen or get back to what is now the new normal. And thank you all for being part of this. Have a great day.
Thank you.